in.
Hello, my name is Brenna and I'll be your student nurse today. How are you doing?
I'm well, how are you?
Good. Can you tell me your first and last name and your date of birth?
My name is Holland Durkin. My date of birth is 10/23/02.
Good. Can you tell me where we are?
We're at Alyssa's house.
Very good. So the patient is oriented and the scene is safe. Are you having any pain today?
No, ma'am.
Awesome. Okay. So I'm going to be doing your physical assessment. We're going to start head to toe. And I'm going to do your vital signs first, okay? So I'm going to do your pulse, blood pressure, respirations, and oxygen saturation. Those were all normal and within limits. So then I'm going to start with your head, okay?
Okay.
The head looks symmetrical. I'm going to be feeling. There's no lumps or lesions. The scalp looks normal with no lumps or lesions. The hair is normal in texture and color and distribution. Okay. Now I'm going to be looking at your eyebrows. Those are symmetrical and even. Now I'm going to take a look in your ears. There's no excess wax or discharge. And the ears are symmetrical. Okay, now I'm going to be looking at your eyes. I'm going to shine a light, okay? The pupils are equal, round, and reactive to light. Can you follow my finger? Good. Okay. Now I'm going to look and just make sure all your other eye structures are normal. No discharge. Okay. So now I'm going to look at your nose. Your septum is not deviated. Your nose is midline. Can you breathe in one nostril? Good. Can you breathe equally through both?
Yes.
Okay. And throughout this, you just let me know if you have any tenderness where I touch, okay?
Okay.
All right, so I'm gonna have you smile. Can you smile and frown? Can you puff out your cheeks? Very good. Okay, can you stick out your tongue? The tongue is midline, pink, moist, and intact. The cheeks have no lesions. I can see your uvula. The teeth are intact. Alrighty, and your lips are pink and moist and not blue. Very good. Alright, so can you open your jaw for me? Good, I'm going to make sure there's no TMJ click. Very good. Okay, moving on to your neck. Can you turn left, right, up and down for me? Good. Is there any pain when you turn your head?
No.
Good. Okay. Now I'm going to have you turn this way and make sure you have no jugular vein distension. Good. Alright, and I'm going to feel for your carotid artery and your lymph nodes. I'm going to do your lymph nodes first. And I'm going to feel your carotid artery on this side. Feeling for carotid roots. Then I'm going to listen for carotid roots by auscultating. Alright, now I'm going to move on to your arms. There's no swelling or edema. I'm going to take your pulse, your radial pulse. And then I'm going to feel the temperature of your hands. They're warm. The color is normal. And then I'm going to feel your nail beds just to make sure you have good capillary refill. Good, it's within 3 seconds. Okay. All right, can you push against me? Good, so the patient can push and resist equally on both sides. Alrighty, so next I'm going to be listening to your cardiovascular system. So you can sit up on the side of the bed, it's fine. Okay, so first I already felt her pulse, so then I'm going to feel for the apical impulse. I'm going to palpate the apical impulse. Then I'm going to listen to the aortic, pulmonic, tricuspid, and mitral areas after I listen to the apical impulse. I'm listening to the apical impulse for 1 minute. Then I'm going to listen to each of those areas. Okay, good. And then now I'm going to listen to your lungs, so I want to just have you breathe deeply in and out.
Okay.
And then I'm going to watch your chest to see the rise of your thorax. And I'm going to listen in 10 places on the front and then 10 places on the back. Okay, and then I'm going to listen to your back. Just keep breathing normal. So I can see that the thorax is rising every time she breathes. I'm going to listen to the 10 spots. And I'll listen to the 10 spots on the back for lung sounds. And you just breathe normally. Good, and your respiratory rate is normal, so very good. All right, now I'm going to do your abdominal assessment. So I'm going to have you just expose your abdomen, that's all you have to do. So I'm looking for any distension or visible lumps in her belly. So the abdomen is not distended or tight looking. It looks normal. Then I'm going to auscultate before palpating, starting in the right lower quadrant. Good, so I can hear bowel sounds in all 4 quadrants. Next, I'm going to palpate, and you just tell me if you're having any pain, okay?
Okay.
Everything feel okay with that?
Mm-hmm.
Okay. Alrighty. So can you tell me when your last bowel movement was?
This morning.
Okay, and is there ever any blood in your stool, or have you noticed any recently?
No.
Okay, is the consistency normal, would you say?
Mhm.
Not runny or diarrhea?
No.
Okay, and can you void independently
Yes.
and frequently?
Yes.
Okay, how often would you say you urinate a day?
3 to 4 times a day.
Okay, and then are you having any trouble with your genitalia?
No.
Okay, sounds good. I'm gonna have you sit up on the edge of the bed. All right, can you push against me on your legs? Good. Okay, I'm going to feel your pulse on your foot. Good, so I've identified pulse in both extremities. There's no swelling or edema in any of the extremities. I'm gonna assess the capillary refill on the foot and the hand just to make sure. Good, and the temperature of the toes are warm, not cold, and not blue. All right, can you stand up for me? Can you take a couple steps this way? Good, okay. Feel like you can walk okay? No pain with ambulation?
No pain.
Alrighty. Anything else you have concerns with today?
No, ma'am.
Alrighty, thank you very much for letting me do your assessment.
Thank you.
Alrighty, have a good day.
You too.